Welcome to Under the Rug at Work, where I shine light on things that are normally swept under the rug. Today, I'm chatting with Dr. Johanna Lynch about the sense of safety experience. Johanna is a GP, an advisor to and the past president of the Australian Society for Psychological Medicine, and a senior lecturer at the University of Queensland. Thank you so much for joining me, Johanna.
Thank you so much for having me.
You're welcome. I'm excited about this chat. But before we jump in, can you tell us a bit about your background and experience?
Yeah, sure. I've been a GP here in Brisbane for about 25 years, and the last 15 of those years I spent mostly looking after adult survivors of childhood trauma and neglect. And I found in their stories a pattern of neglect that had come from how we saw them as people in the medical setting. Things like their life stories, their relationships, what was meaningful to them, were being neglected in sort of the way we were sort of taught to assess somebody in distress. And so that led me to, first of all, try to solve that through setting up a little clinic. And I had a transdisciplinary clinic which had mental health nurse, psychologists, social workers with expertise in attachment and yoga-based care for trauma, as well as art therapy and at one time even music therapy. But I really struggled to make that work in the current kind of funding models we have around care and mental health. And I also was still a bit unnerved about what I was doing. It was a little bit not quite psychology, not psychiatry, not really mainstream general practice. And so that led me back to becoming a researcher. And I did my PhD looking at this concept sense of safety to see if it is something that's genuinely useful across the disciplines and helpful for patients in the way they understand themselves and the journey to recovery. So that's a big, out of that came a book, and out of that has now come a course. But the main message is that I just want clinicians across the disciplines to see people in a slightly wider way than we're taught to in our disciplines, and to help patients to see themselves in that way as well. I had one patient once say, I've been in this hole for so long, but you saw things that can help me get out of it. Nobody else was looking for what you were looking for.
Mm.
And I think that's a little key, is if we get better at looking, we can see things that when the person themselves can't get themselves out of the hole and don't experience themselves as whole, WHOLE, then the way we see them as whole can help restore them to well-being.
Yeah, I love that. There are so many people that I need to connect you with, even just from what you've shared there. But it feels like you're um, too advanced almost. It feels like what you set up, that clinic's not running anymore, is it?
No, unfortunately, I closed it. It was a time when I was a young mom as well, and I had to prioritize my family. But I do know that it was a pioneering kind of space, and it was part of my journey too, because I learned from those other clinicians, and I became more confident in multidisciplinary work, and I got influenced by the other disciplines, and they've changed my mind and helped me have a wider way of seeing. So it was an important part of my journey. And I don't think I'm designed to be a sort of manager of a clinic anyway. I'm more of a thinker and a dreamer, an
Yeah.
idealist, and a kind of almost seeing big pictures is part of what I really enjoy, and bringing different people together who would not normally talk to one another and discovering how much they have in common is sort of where I sit.
Yeah. And that leads to innovation, that leads to looking at things in different ways, and it leads to better outcomes because the outcomes that we're getting, the mental health stats show what's going on. So that's kind of why I was saying it's future focused. It feels like this model should be implemented everywhere.
Yes, I do dream of that.
And hopefully we can get this message out. And I know you're coming to the summit where there'll be a few people that to connect with that are doing things in similar areas. But I will share, and I know this is really early in the pod, but I will share your contact details for anyone who wants to get in touch with you about that big picture as well, because you truly do look at people as a whole person and holistically. And the system, unfortunately, does a lot of damage. And we need to look at people as people, because there's a few things that are really missing. And can you share with us what happens when people don't feel safe? What happens to us? And I think throughout this conversation, it'll help identify that holistic approach and that holistic view, because you are the expert in that area. So I'm super excited.
Yeah, yes. Well, I guess I would say, even as we're talking, that our system is under threat and the different practitioners in it are under threat.
Mhm.
And if we think about workplaces, a lot of them are under threat from various different types of things. So we can apply these same principles I'm going to talk about, what happens when we don't feel safe, to systems as well as to individual people. And so it helps us understand even people who are hurting us. It helps us understand what's going on underneath for them. And I guess the first thing I think that happens when we don't feel safe is that our world narrows and we become focused on survival. And that stops us seeing the bigger picture. It stops us understanding or even taking time to notice what the other person is experiencing or what's going on around us. And it also fragments us. So I love the definition of distress. The original, I think it's a Latin word, is to stretch apart. And so that sense that when we're distressed, we stretch apart inside ourselves, but also when we're trying to care for somebody who's in distress, we stretch apart as well. And I guess I would see our whole systems are stretching apart. And so it actually takes energy to bring things back together. And I sometimes use the analogy of Humpty Dumpty, those of you who know that nursery rhyme, of this little egg sitting on the edge of a wall and falling off the wall, and nobody being able to put him back together again. And I kind of think what happens at least in the medical space that I know better, is that we divide the body up to study it, to take more care, to be more precise in how to be able to predict and offer special treatments for each part of the body. But then each of those disciplines have got now their own dialect, their own language, and they really struggle when they're trying to see the whole back together again. And there are very few people in the system whose job it is to see the whole. And in fact, that work is very undervalued. It's not even noticed. And those of us who do it often feel like when we do it well, it becomes invisible. So if you help someone become whole, or you stop someone going to hospital, or you prevent a workplace incident through quality management of the people involved, and it never escalates to something bad, all of that becomes invisible, that work of holding the whole. And in general practice, we also often talk about ourselves as the unpaid carers of the system, and I think of us like hosts of a in the background, where you're making something work well, but you're not noticed. So I guess part of my passion too is to encourage those people in the system who are good at seeing holes. And the generalists in the system are not just GPs. Generalists can be in any profession when you're good at seeing the whole picture and bringing together environment, the other person's point of view, and your own point of view, to make something unified.
And you have kind of touched on this, but is there anything else that you wanted to add about that whole person approach? Like, what does that mean, and why is it important? You did kind
Yeah.
of touch on it, but anything else you wanted to add?
Yeah, so there's a beautiful clinician in this space who says we need to look at the whole at appropriate depth. And I've had this kind of dilemma, like, what is appropriate depth? Like, how wide should we know? And the conclusion I've come to in my work is that I should care about anything that causes another human being threat.
Mm.
And so my PhD work was actually asking clinicians, Indigenous academics, patients, GPs who are rural and urban, and mental health clinicians, what they thought caused threat, and how the people sensed that they were safe. And then I mapped that, and that became what I call the whole person domains, and they include environment. So things people repeatedly mentioned injustice, making them feel threatened. And obviously practical things like finances and housing and political and policing security. But then they also talked about social climate around a person, so where they live and where they learn and where they work. What's going on in those environments? Is there bullying? Is there aggression? Is there addiction? Is there poverty? Is there hopelessness? One Indigenous person talked about listening to stories that have happened to other family members as a child. So what's sort of around a person can cause threat. And then their personal relationships, who's there and who's missing, and what's the quality of those relationships. And people described relationships that were available, tuned into you, and on my side as things that help them to feel safe. And then there's the body. So in the body, yes, there's illness, but there's also things like sleeplessness and pain and big emotions that are overwhelming. That can make someone feel frightened. So being frightened even of our own reactions can be, especially if we've been in experiences when we're very young where they've been overwhelming. And then there's our inner experiences. So not just our thoughts, which can be sort of troublesome in their own right, but also things we perceive, whether or not we perceive that we're supported or not, how our attention is focused. So if we can't see beauty or goodness and we can only see dark, frightening things, and also things that we envision and flashbacks, things that not necessarily are images or a particular scenario, but more a whole body experience of feeling overwhelmed or hopeless. And I think a lot of suicidality is in that category. And then there's our sense of self. And somebody described our sense of self as our reputation with ourself. And I like to think of it as our attitudes and the way we communicate to ourselves. So, do we ignore ourselves? That's a kind of threat. Do we attack ourselves and critique ourselves all the time? And so there's a need for inner unity and connectedness that can heal that. And then lastly, the spirit and meaning. So people can have deep safety in that space where they've made sense of their world and they have some connectedness to something bigger than them. And they feel safe in that. And others can feel really distressed in that space, feel blame or punishment or some kind of guilt or grief. And so knowing all those layers of being a human is part of the whole.
Yeah. And you mentioned you've got a book and a course. Do they dive into each of those areas?
Yeah, so my book is a sort of reflection on what it is to be whole and how careful we have to be about how we use language and how the words distress and healing help us to stay with that whole version rather than disorder and cure, which can become quite specific. Um, and then it has some details about my research into these ideas of whole person care and the sense of safety dynamics that help you to feel safe. And it also has a little section on the nouns of disorder and the verbs of well-being, and about how when you get really specific into parts, you can get a bit addicted to naming everything. Whereas when you are more aware of whole processes and across the whole person, you can pay more attention to the verbs that help people get better. So that's in the book. And then the course has 5 sections that are around whole person care, trauma-informed care that's from a whole person lens, so not a psychiatric kind of legal or insurance definition of trauma, but a more connected to the Greek original meaning of the word trauma, which is wound. Which is around how the person themselves experiences what happened. Because I've just come across so many things in my work where other people wouldn't have called it traumatic, but for the person themselves, it was completely overwhelming at that time. And then it has a section on relationship-based care, and our own relationships as practitioners are a part of that. And a section on embodied awareness, which brings in the science, the molecular science around how stress changes our cells and changes how we relate to our community all the way through the whole. And then the last section is what I think is most important, is healing orientation. So whenever we go near trauma or distress, to have this sense of what will help somebody to be whole again. And that brings in these sense of safety dynamics that help people to feel safe again.
Mm. So much of what you have said, and what you're doing ties directly and indirectly to the psychosocial hazards and workplace safety and leadership and even, some of the tools that I share in training and development, giving people that awareness of what they can do and how they can do it to help grow and improve. Can you give us some tips or advice on how workplaces can develop, or leaders develop, a sense of safety in their team? What could they do?
Yeah, so I think part of this is about leaders caring for themselves. And so a lot of when I speak in this area and in the course, we're trying to pace it with reflection for the practitioner to be, how do I care for my own wholeness? Because when we're filling in fragments ourselves, it's very difficult to see the whole of somebody else. But it's also because we matter, like as leaders, our well-being matters too. And so there's, so I guess some of what I'll say now is for the leader themselves as well as for their team. But I think it's mostly an attitude towards people. It's a kind of mindset where we're very aware that people are multi-layered, that they can often only show us a little bit of themselves to begin with because they don't know whether to trust us, and that's completely natural and normal. And that as leaders, we're aware of what they've shown us and that there might be other layers to them that we need to care for at the same time as the kind of confident person they're presenting to us. And so not to be surprised that somebody who looks confident might also have pain that they're carrying. And sometimes the most capable people have overcome much to be where they are. And yet every now and then they can have something that sets them off, that brings them back to their pain. So for me, being aware of those multiple levels, like what's going on in their environment, and that includes the working environment, um, and it includes what's going on at home and the bigger picture of their kind of ecosystem that they're part of. And then what's going on in their relationships, and including the kind of climate around them at work, and what they experienced in the different stages of their life through learning and home. And of course, who's in their box, so who's there with them and on their side, and getting to know who that is and using that as a resource for them if they need it. And then, of course, their inner life, so who are they? What's going on in their body? So being aware of illness and sickness and pain, sleeplessness, all those things affect how we function, and right through to existential kind of calm or peace for them. So I think that being aware is there. And then if we think about the dynamics that help somebody to feel safe, one of them is broad awareness. So that means, say, somebody comes in and they're freaked out about one particular thing. We don't join them in the freak out about that particular thing. We stay broadly aware and we draw them back to being broadly aware. So, for example, if they're telling a story only from their point of view, we pay attention and listen in to see if we can understand what it was like for the other person. And if they are unaware of the bigger picture, like there might be a structural thing going on in the big organization that they don't know about. So just drawing them back to a bigger view can help to put things in perspective. The second thing is calm sense making. So that can be to help them to organize through the conversation. So to not draw out the little pieces of the conversation as though that's what the final result is, but to think of the conversation as an organizing experience, that we're trying to help somebody organize their thoughts and get to a place where they understand it more clearly and they can put it in a clean sentence, what's happening and what's the matter. And we can use writing and reflection as part of that process. But I think we often underestimate the importance of dialogue for calming. And then the third is that sense of respectful connection. So we treat people with respect, we expect them to treat us with respect, and we're watching for other people in their life that might be not treating them with respect. So this is relevant if we think somebody is quite distressed at work, to actually consider, are they having something going on at home that's dangerous? Are they in a domestic violence relationship, for example? Or have they been chronically abused inside their families, taken for granted and used in different ways? And can we in the workplace offer another point of view that says to them that they're worthy of care and they're worthy of respect? And so be healing in that way. The fourth is capable engagement. So capable engagement is helping people feel safe enough to take on tasks. And we know from the psychological safety literature around workplace safety that if someone's feeling safe enough at work, they'll be more innovative, they'll be more of a team player, they'll be more creative in what they do. And so that sense of providing a workplace where somebody can step into that requires a reciprocal thing of offering access and opportunity for someone and encouragement. I think, the voice of encouragement. Recently, somebody said to me, don't ever leave encouragement silent. Like if you think you can say it, say it. And so that sense of the empowering way we use encouragement and access to help people in our community. And then the last one is owning yourself. So helping people take responsibility for their actions and their choices and for their own understanding of their own reflective experience of what their emotions mean and how it connects to their own personal vision of their life. Those are the five dynamics of sense of safety.
Yeah, fantastic. And we were chatting earlier about leadership and people getting into leaders roles. And it's actually really tough. We can't be doing the same thing and the same work that we were doing to get us there. We need to have a different skill set. And managing people is hard. So the tips and the tools that you've just shared are incredible to be able to give people the ability to have a sense of safety in their team. Um,
So yeah, my sense is really that it's also important for us to notice that the leaders themselves are often in difficult circumstances. They might be not having a sense of their own tenure in their job or might not being supported by the wider organization that's more focused on profit or than people or whatever it might be. And so for us to think, actually, well, how do we help leaders have a sense of safety in themselves? And some of that is actually helping them to reflect on their own journey to where they got to and notice all the parts of their journey that have added up to them being in this role. And again, I think of that as another part of that calm sense making, where you're reflecting on your own, like, how did I get to here? And seeing it as a solid kind of foundation behind you and within you to enable you to continue to lead and to lead with your own sense of integrity, no matter what the organization's doing around you, because you're more solid in how you sense your own sort of self in the journey. And often people will describe feeling like I'm just at the starting all over again or something like that when they take on a new role, or the kind of imposter syndrome, I don't know what I'm doing here kind of thing. I actually think imposter syndrome should be named pioneer syndrome,
I love it.
because it's what happens whenever you're on the edge of where you haven't been before and you're trying something new, whatever the field or whatever the stage of life. It actually just always comes with that funny feeling that I don't know what I'm doing. It just is a side effect of being in that position.
Yeah.
So whenever you get that feeling to actually know, maybe I'm pioneering something here, pioneering something in my own life, or pioneering a new idea, or pioneering a new way of being with other people, and to feel that funny feeling of, I think something's wrong with me, or I don't know enough, as
Mhm.
actually a signal to say, actually, you're right where you're meant to be if you're wanting to change something.
I love that. Yeah, I love that. And I know exactly what that feeling is.
Yes.
And everything, excuse me, everything that you have said is so relevant. I've actually had 3 conversations in the last 2 days around exactly that. There is so much uncertainty with organizations. There's so many people that I've spoken to who they feel like their organization is more about profit than people. And even some of them are focused on supporting people, but there's, regular restructures and regular change, and leaders being put into positions without the proper support or training or understanding of these tools. So yeah, it's so relevant. I'm so excited to get this pod out. I have never nodded as much as I have with with you in a podcast.
It's a very encouraging interview, I got to say.
Oh, I love it. I love everything that you do, and I know that other people will as well. So what's the best way for them to get in touch with you, to find out more about your book, and to connect with you?
Well, I love LinkedIn connectedness, so feel free to join me on there, because that's where I tend to put my latest things that are coming out. And then I have two key websites. One is senseofsafety.com, and that has kind of like a summary in pictures of my PhD. The research behind it is all listed there, and then some free resources that you can use straight away in the sharing section of that website. Including a free micro learning about the course that's coming up, if you want to have a check out and get on the first ones to know about when that's released. And then my other website is drjohannalynch.com, and that's got a little bit more of my kind of academic story with like an online CV, so you can check me out a bit, and ways to get into being mentored by me is at hello@drjohannalynch.com, and there's some things on the website about that. And then things I've done recently, so there's some videos and other podcasts and things listed on there, so feel free to, and I'll be putting this one up there too, so look forward to that.
Fantastic. And I'll include the links in the show notes as well. But thank you so much, Johanna, for everything that you do and for coming on and sharing your knowledge, your wisdom and experience. I really appreciate it, and look forward to connecting at the summit. I will see you there.
I look forward to that too, and keep up the good work of encouraging good workplaces that keep people safe.
Fantastic. Thank you, Johanna. Appreciate it.
No worries. See you. Bye-bye.